Okay, I think we can start. I see that the magic number of 100 participants have been reached. We are very happy to have all you with us this morning. My name is Andrea Giustina, and I'm really glad to welcome you to this second edition of the Hypoparathyroidism Patient Forum. I will chair this event together with Natalie, that you know very well, and she is the representative of the patients, since this event is thought and put in place for the patients and to testimony the alliance between the health professionals and the patients in this disease, which is a disease that needs attention, needs to be cared at the best, and also needs to be attention by the health authorities. I would say a few words and then pass the microphone to Natalie for starting the meeting. May I have the first slide? These are some announcements that could be useful for you for following the meeting. There will be simultaneous translation. We learned quite a bit from the first event that, as you remember, was last year. Was a very successful event, but clearly there are always some details that can be improved. You liked very much the translation. We will have 3 languages, French, Spanish, and German, and this translation will be live simultaneously. And as you see in the slide, you can choose your language, your favorite language, and click on the interpretation button, the icon with the globe at the bottom of your screen, and choose the language you want to hear. If you follow the event in English, there is no need, obviously, to change to choose the channel with the language. Next slide. Okay, so this is the instructions in each language that you need to follow for the translation. Next slide. Okay, these are other practical information. There is a Q&A button, and so you have the possibility to ask questions using this button, which is, as the others, at the bottom of the screens. And the questions will be discussed at the end of the session. The chat button is only for technical administration, if you have problem with the connection and so on. The questions submitted in languages different than English will be translated. And so the use with the Google Automatic Translator and put back in the Q&A box in English. The session is recorded. So clearly, this is a note that I think is important, that we are not able to give medical advice or answer questions related to specific circumstances or cases that are raised by the patients. Next slide. Okay, so as I was saying, the forum was something that I really wanted to put in place when I was president of the European Society of Endocrinology. We thought that the movement of the patients with hypoparathyroidism was a very important movement to support and to create an alliance with. The forum started as a pilot project bringing together the experts and the representatives of the organization. And I think this worked very well. The enthusiasm and the effort put by the patients was extraordinary, and clearly also the contribution of the professionals, of the experts, was really remarkable, and I'm very happy about that. And these are some pictures of the first forum, and I think that you remember this event. For those that are new, I think that this year, and this is an example of how is successful these initiatives, this year we have more participants and spread the word, because I think these moments are of paramount importance, and really we can confront on everyday problems and also open windows on what can be the future for which we are working every day. And at the end, all the work that we are doing is for you, is for the patients. Next slide. Obviously, just to remember what were the topics of the first forum and how you can access the recordings on the ESE website. Next slide. Just to illustrate a little bit how did it work, we have a working group which is really active all the year long, and I have to thank all of them, and particularly I have to thank Magda, who has been really fantastic in coordinating all the work and in keeping ourselves focused on the project. And I think that her work and that of Vicky has been fantastic, and I would like to thank also them for what they did. And the success of these initiatives is for sure in great part due to their very, very important work. Next slide. Clearly, the initiatives concerning hypoparathyroidism are really many, and this is the testimony that the society has really in its heart the disease, the patients, and so there are these guides, these leaflets that are part of the so-called PARAT, which is an educational program that has been chaired for many years by Jens Bolleslev, and I think he did a great job. And also this education in terms of the patient needs, I think is very remarkable. Next slide. Again, to remember you the emergency card, and again, this is something that could be very important. We know in the day-by-day life that could be the need for hopefully less and less nowadays in the future, but could happen that there is a need for an emergency treatment of the patient with hypoparathyroidism, and therefore this emergency card has been, I think, a very important advance. And finally, I would like to remember you that this ESE is also very active on the academic and scientific level in this disease, and the preparation is in preparation. There are the new clinical guidelines. The first edition in 2015 has been very successful. 10 years later will be another very important piece reviewing all the indication for diagnosis and treatment of hypoparathyroidism. And again, this effort will be chaired by Jens Bolleslev, who has been one of the champions of for hypoparathyroidism in European Society of Endocrinology and in Europe. Next slide. Okay, very good. So from my side, that's all. I wish you a fantastic 2 hours of interaction, of growth, of synergism, and why not, of fun. So thank you very much. And Natalie, the floor is yours.
So hello to everyone. I am Natalie. So I am the co-founder of the French Hypopara organization, and as already mentioned by Andrea, I'm also co-chair of the ESE Hypoparathyroidism Patient Forum, but I am as well a hypopara patient. On behalf of all the European hypopara patient organizations that have helped organize today's session with the ESE, the European Society of Endocrinology, we would like to thank you for attending today's event. We do hope that you will find that the information that we are sharing today is useful. And as Andrea has mentioned, I would like to remind you again that you can ask questions in the Q&A box that is at the bottom of the screen. Those questions you can ask them in English if you do not speak, if you do speak English. If you ask them in your local language, somebody will translate them to English in the Q&A, but you can also, before posting it in the Q&A, translate it with Google Translate on your site and then post it in the Q&A. Last year's event, we mentioned the essentials of our condition. And we do invite you really to go check out those videos that were translated to French, Italian, and Spanish. This year, however, we decided to focus on more complex topics, more complex in the way to present it. But these topics do affect most of hypopara patients. It seems we frequently have difficulties in adjusting our treatment. We may just not know how to, depending on our daily activities. And that can be, for example, when we do sports, when we go out with friends, when we want to attend social events, for example, family outings, at work, during meeting, or any event that requires that little bit extra muscle or brain activity. During the early stages with our condition, we are generally unaware of what will trigger the symptom, and we are even unaware that they may be related to our condition. So we are unable to be proactive, and we generally do not recognize the onset symptoms that appear before the full-fledged tetany. With years of experience, we know better what may trigger a sudden drop in our calcium levels. We can recognize the initial symptoms, but we may not know how to avoid them, leading us to stay at home. We may refuse family outings, social events. We may stop traveling. We may need to stop working. We may need to stop sports. And there is so much more that we no longer dare do. And this will lead us to become socially isolated. It also appears from discussions within patient organization forums, these are our private Facebook groups, that we also frequently encounter doctors that maybe do not know about our condition, doctors that may patronize us or belittle us, and we may even have certain hypopara symptoms that have been diagnosed as being unrelated to our condition. And this is the reason we chose the topic of this year's session: adaptation of treatment in everyday life and talking to your doctor. We hope we will be able to provide you with a fast-track session, as you may learn some tips from a more experienced patient and mostly from the clinicians that are specialized in our condition. Could we please have the next slide? This is also the reason we would like to share with you the known European hypopara organizations that you can see here, and remind you how important it is to have one locally. Patient organizations do give a place for all hypopara patients to discuss their issues, to find support in dealing with their difficulties. And as mentioned last year, you may start small, and we would like to thank Romania that has just started their own hypopara organization. And like them, you can just start with a Facebook group, and then you can create your own website, but that is not essential at first. Websites do help provide information to those that don't like social networks, but the most important at first is the patient forum. The fact that you're able to have several hypopara patients regroup in one place obviously will help the patients as they can exchange and talk about their daily issues, but it also helps clinicians do research on our condition, as they're able to find a large enough amount of patients to make their research relevant. It also helps in getting information in your local language. It helps create awareness within your country, and it also helps you communicate with your doctors better. So it basically improves the level of care for patients. Next slide, please. Oh, I just wanted to mention something on the previous slide. Sorry. We have not put in here, there is a Tyrol group as well. The link was so long that it's not on the slide, but if you need this link, please do go to Germany and they will provide you the link for the Tyrol subgroup that has been created. As for Sweden, the website no longer seems to be active. However, we aren't sure if it's just because there's a maintenance issue right now. If we have any that are missing here, please do get in touch with us so that we know the other European organizations that exist. Next slide, please. So this is the talk of today. As you see, we have our first session and our second session. Each session will be with a 10-minute talk of a clinician and a 10-minute talk from a patient, as well as a 10-minute exchange between the speaker and the patient. We then have a 30-minute Q&A session where we will be taking the questions that you have posted in the Q&A box at the bottom. With that, I would like to hand over to our chairs of our first session. Thank you.